People often ask me, why I transitioned and how I transitioned from practicing medicine to being a CEO at a healthcare company and starting a healthcare company and growing, what we've done at E7 Health. Part of it was, I think, once you have enough experience and you see the issues more clearly, when you see the issues especially from the patient side, what the shortcomings are in the healthcare industry, and you see the problems and the good points of insurance companies and hospitals and other healthcare providers, when you have that whole perspective, I think the temptation for me was that, hey, I have all of this perspective that's pretty unique. How can I take that information and try to create something that on some level tries to address those things? What can we do to improve patient quality in ways that maybe nobody has thought of? What can we do to improve patient experience in ways that nobody has thought of? And if you want to do that, it becomes difficult to do it just seeing patients. And so I think for me, that was the big lure. How can you transition from helping one patient at a time to helping many, many patients? One of the things that I'm so proud of at E7 Health on our website, we have over 10,000 positive reviews in a span of, I believe, 3 years. And if you read those reviews, it almost sounds like the same person wrote them. And the ability to get 10,000 people to tell you how unique and amazing something you created with the help of a lot of other people, by the way, in the organization, that's gratifying on the same level as helping one patient at a time. When you can create systems, and of course with the help of many others, when you can create systems that are able to impact patients in much broader ways than any one doctor could have, that gives you somewhat similar satisfaction, but maybe even more than seeing one patient at a time. So I think for me, it was understanding that there's risk in leaving traditional medicine. But if you garner all of the knowledge and experience you got from being in traditional medicine and take those forces and those ideas and create something unique, it's almost a crime not to do it. And that only really goes to show you that going into clinical medicine and practicing, gives you the insight that if you hadn't done it, you couldn't have created something like, for example, we did. So I'm so thankful for those experiences, and they're amazing experiences, and I look back at them fondly, of course. But I also know that if it wasn't for those experiences, it would probably be next to impossible to understand how to create something else that changes patient experiences so much. It's something that only someone in the throes of all the issues could sometimes see, where the friction is, where the rub is. I know in one of our other series, we talked about the problems in the US healthcare system, and understanding those problems that helps you come up with solutions. And you can't understand those problems unless you actually were in the midst of it. So in terms of leaving clinical medicine, hopefully one of the positives is if you leave, you also bring with you those thousands and thousands of hours of insight, of epiphanies on, wow, this could be done better, and it could be done more efficiently and with an eye towards quality and patient experience. So that is what helped me make the transition.